Hello and welcome to OncoPearls. Today we are going to discuss the gene expression signature in breast cancer. Once again, I am Dr. Raza and I am here to discuss all the expressions in the genes that are being carried by the breast cancer. So, the purpose of this presentation is to ascertain the risk of cancer recurrence in the patients who have been treated with the curative intent. And we all know that the gene expression signature in breast cancer, especially in early stage hormone receptor positive breast cancer, is the most important determinant for the use of either chemotherapy with hormone therapy or hormone therapy alone in an adjuvant setting. Numerous types of gene expression signatures are being used in an early stage hormone receptor positive breast cancer. Just to give an idea, few commonly used gene expression signatures are MammaPrint and Oncotype DX. So first we come to MammaPrint. It's a 70 gene signature and it was rigorously studied in MIND-ACT trial that showed that the MammaPrint gene expression signature can be used only in high clinical risk patients. So the patients who have high T disease like T3, T4, high Chi7. So clinically, if the markers show that the disease has a higher risk of recurrence, then MammaPrint can be used to decide whether chemotherapy needs to be used or not. So the most commonly used is the 21 gene expression known as Oncotype DX, and it is backed by TAILORx trial and RxPonder trial. So according to TAILORx trial, the recurrence risk scores are from 0 to 10 that show low risk of recurrence, 11 to 25 that shows intermediate risk of recurrence, and more than 25 that shows high risk of recurrence. Another trial named as RxPonder trial was done in postmenopausal women with known node positive disease having 1 to 3 lymph nodes, and in this trial it was proved that the postmenopausal women with a recurrence score of less than 25 had no benefit in delaying the disease recurrence with the help of chemotherapy. However, in premenopausal women, there was a 5.2% benefit in invasive disease-free survival regardless of the recurrence score. Other gene expression signatures are PAM50, EndoPredict, and breast cancer index, also known as BCI. It is used to decide for the extended hormone therapy. Usually the patients with early stage breast cancer, that is T1, T2, with no nodal involvement, the score of BCI is low and therefore there is less benefit of extended hormone therapy. Just to summarize the ASCO recommendations for adjuvant chemotherapy. So any woman with node negative disease having a recurrence score of more than 30 on Oncotype DX, or anyone with the recurrence score of more than 26, women less than 50 years of age and a recurrence score of more than 16, premenopausal node positive women and postmenopausal node positive disease with a recurrence score of more than 25. Moreover, N2 disease is also a recommendation for adjuvant chemotherapy. I thank you all for the patient listening. If you have any questions or concerns, you can always get back to me by leaving the comments in the comment section.